Hey guys, we're going to be talking about a nasal cannula oxygen delivery device. What I have in front of me here is a nasal cannula. This delivers low flow oxygen to a patient and can provide short or long-term oxygen therapy. This device helps to correct or prevent hypoxemia and decreases work of breathing. 1 to 6 liters of oxygen per minute is the amount of oxygen that should be used with this oxygen delivery device. This device allows for room air to be mixed in with oxygen as well. You want to consider our FiO2 of room air. And if you can remember, that was 21%. With the nasal cannula device, it increases the FiO2 by 4%. Okay? So if you think about the liters of oxygen that you can provide your patient with the nasal cannula, we're going to go over each of these and how it increases the FiO2. Okay, so with 1 liter of oxygen per nasal cannula, that is going to increase your FiO2 by 4%, as we mentioned, so that would take it up to 25%. 2 liters would increase it to 29%. 3 liters would increase it to 33%, 4 liters would increase it to 37%, and then 5 liters would increase it to 41%, and then with your 6 liters of oxygen per nasal cannula is going to increase it to 45%. And so this is all referring to the FiO2 of your nasal cannula device. With the nasal cannula device, you will see that there are 2 plastic prongs that allow oxygen to flow from the cannula into the nares. Before applying the nasal cannula to the patient, you always want to make sure that the oxygen supply has been turned on and is flowing through the oxygen device. As you apply the nasal cannula to the patient, be sure that these prongs here tilt backwards towards the patient. Okay? I want to show you our mannequin here, and you will notice that these prongs are tilted in the nares back towards the patient. That allows that patient to receive all of that oxygen. You're going to wrap around the tubing around his face and around his ears here. You will notice that on the sides of the nasal cannula behind his ears, I have used foam ear cushions to prevent the development of pressure ulcers behind the ears. You'll notice that there is tape located here, but normally that would not be what you would do on a real patient. This is for our mannequin here. The nasal cannula is ideal for a patient who is in minimal respiratory distress. A patient who is a mouth breather or who has sleep apnea would not be a candidate for this type of oxygen device. The nasal cannula provides patients with a comfortable and convenient oxygen device so that they can talk, eat, or cough. When you are using a nasal cannula device, there are several considerations that you want to take into account. Policy states that humidification may be necessary for any flow rate that's greater than 2 liters of oxygen per minute. For any flow rate less than 2 liters of oxygen per minute, humidity can be used, but really only if the patient requests it for any kind of nasal irritation or dry nares. This concludes our nasal cannula video. We look forward to seeing you in the next. Thank you.